Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Very glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Mercy Medical Center, Studio Arts and Glass, and of course, our socially distant technical producer, JD, who's not here today. The show is coming to you live from the administrative offices, and we are joined by our guest, Dr. Aaron Brescia, board certified head and neck surgeon from Ohio Head and Neck. Good morning, Dr. Brescia, and welcome to the show.
Well, thank you. Glad to be here.
All right. Sinusitis is one of the most commonly diagnosed diseases in the United States, affecting an estimated 16% of the adult population annually. Many who suffer from sinusitis consider it to be debilitating. In fact, Harvard researchers found that sinusitis sufferers reported the highest levels of pain and the lowest levels of social functioning, as well as significant problems with work, energy, mental health when compared to other chronic conditions. If you or a loved one has suffered from sinusitis, you won't want to miss today's show as we discuss sinus and allergy treatments with Dr. Brescia. We'd like to remind our listeners that our program is available on our podcast, and you can subscribe in the App Store. Just look for the Medicine Center Pharmacy and Health Matters, and you can listen to any of our programs anytime.
So, Dr. Brescia, introduce yourself, please, and tell our listeners a little bit about yourself and about your practice.
Yeah, so I'm Aaron Brescia. I grew up in Akron, and after finishing my training, moved back here to Canton in 2009. So I've been with Ohio Head and Neck Surgeons for 11 years now. My wife and two sons live in Jackson Township, and lifelong Northeast Ohioans.
Okay. People try to blame everything on sinuses for all kinds of problems.
Right.
What are sinuses and where the heck are they located?
Well, sinuses are air-filled spaces within the facial skeleton. They are lined with tissues, just like the tissues that line the nose. Those tissues make mucus. Those tissues are supposed to also sweep that mucus out of the sinus exits, which are unfortunately very narrow. There are sinuses located above the eyebrows and the forehead. There are sinuses below the eye sockets in the cheeks. There are sinuses between the eye sockets, and then there are sinuses behind the eye sockets. So,
do we need all
spaces.
of them?
Yeah, it's an interesting question. We don't actually, there isn't a real consensus as to why we developed sinuses or what the actual function of the sinuses are. At the very least, being air-filled spaces and not solid bone, they make the face much lighter than it otherwise would be. There's also a thought that they are almost trauma absorbing or shock absorbing spaces that are designed to crumble before a trauma gets to deeper structures like your brain or your brain stem. Not unlike a crumple zone at the front of an automobile, designed to collapse and absorb pressure before more vital structures are encountered. So somewhere in there, maybe it's a combination of both, but there isn't really yet a scientific consensus as to why we've developed sinuses, which I'm sure is frustrating for people who suffer from sinus disease, wondering, well, what's the benefit of these things if they're just a source of a problem?
Interesting.
So how are the allergies and sinuses connected?
Right. So one of the problems with the design of the sinus cavities is they're large air-filled spaces, but the exits to them, the natural outflow tracts of them, are very narrow. If you can imagine, if you had a basketball arena full of people and there was one regular sized door for everybody to get out, and then if there was a fire or an emergency, it would be very difficult to get all of those people out of that one exit, right? It would take a long time. It would be not efficient. But unfortunately, that's the way our sinuses are designed. And so the way that allergy and sinuses sort of intermingle is anything that causes inflammation in the nose, whether it be a cold or allergies, can further narrow what is already a very narrow exit door, which can be enough to essentially make it non-functional. And then the secretions that are made all day long in the sinuses as a normal process are trapped. And so whenever you have secretions trapped in a body cavity, you're at risk for infection in that cavity. And so that's a way in which allergies can put you at risk for sinus infection.
So you're not saying that the infection emanates in the sinuses. It emanates in the nose and the nasal.
No, it would emanate in the sinuses because the secretions are manufactured in the sinuses. But if the secretions can't get out as they would normally would be swept, and the natural process would be you make secretions and they get swept out of the sinuses all day long and swept into the nasal cavity down the back of your throat, and you swallow them and you don't notice it. When those secretions can't get out of the sinuses, then they stagnate. And it's almost like having, it's the difference between having a running brook or a stream versus a pond with stagnant water. Pretty soon those stagnant secretions can get infected. And so then you have essentially a bubbling cauldron of infected secretions trapped in a sinus cavity.
I see.
Okay, so how about this? What are the signs and symptoms of a sinus infection?
Yeah, so they're not terribly unlike the signs and symptoms of a normal cold. Inflammation in the nose, nasal congestion, difficulty breathing through the nose. Oftentimes there's a decrease in the sense of smell and therefore a decrease in the sense of taste. Pain or pressure over the sinus areas depending on which of the sinuses are involved. Usually you're producing a lot of secretions, blowing your nose a lot, and you're getting out thick, opaque secretions. You feel like you're swallowing this sort of these foul tasting secretions, as opposed to say, when you blow your nose because of allergy, it's typically clear. Or if you blow your nose within the context of a normal viral cold, that's typically clear. Sometimes it can get a little thicker. When you have a bacterial infection in the sinuses, you're typically going to have very thick, tenacious secretions. It's not subtle. And so, a lot of those symptoms can overlap. One of the things we look at are symptoms persisting beyond a certain amount of time. So your typical cold, nasal congestion, runny nose, difficulty smelling, all those things, pain or pressure in the face, typically will peak around days 4 or 5, and then they should start to wane, and you should start to feel better after, day 6 or 7. If patients' symptoms get worse after that time, after day 5 or 6, we start to think, well, they're probably developing a bacterial sinus infection. If symptoms persist beyond 10 days and aren't improving, those are things that we look at to say, okay, this is now a sinus infection, as opposed to, say, a viral cold that we get all the time. So it has to do with the intensity and the duration of symptoms, where we start to suspect that you've actually developed now a sinus infection. So that's why your doctor may be hesitant. If you go, if you feel crummy for 2 days, blowing your nose, nasal congestion, and you go to your doctor and you want antibiotics, your doctor may be hesitant to prescribe antibiotics because it's inappropriate, really, until those other benchmarks are sort of met, because we don't want to over-treat viral illnesses with antibiotics for a lot of reasons.
Okay.
So how do the sinuses get infected?
Well, there are 2 main types of cells in the lining of a sinus cavity. One type manufactures mucus, and one type is specialized to help sweep the mucus out toward the exits of the sinuses and into the nasal cavity. Sinuses get infected typically when those exits are blocked, and either from things like nasal polyps, actual tissue in there that's blocking up the outflow tracts, or just even inflammation that blocks the outflow tracts and the secretions get trapped. That puts you at risk for infection.
It seems like a complex system when it's. I don't think it's really needed, is it? Is that what you're saying? Or,
Well, that's not my department.
I just when you think about it, you think about
Yeah.
all the aggravation that people get.
That's right. That's right.
They go, what's this about? So,
Right. I mean, even things like irritants. If you're a woodworker and you don't wear a mask, if you're inhaling particulate matter that is an irritant to the lining of the nose and sinuses, that can incite inflammation, and that inflammation then blocks up the exit tracts of the sinuses. Secretions get trapped and you get infection. So anything that causes irritation or inflammation in the nose puts you at risk for infection.
okay, I guess we're going to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy. Are you there, Joe?
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking this morning with Dr. Aaron Brescia from Ohio Head and Neck Surgeons. So, Doctor, how many sinus infections per year are abnormal, and when should you really get to the physician?
Well, there's no normal amount of sinus infections that we should expect. So one is abnormal. But we don't necessarily think that people need surgery or serious intervention in the sinuses unless there seems to be a pattern. Something is putting them at risk for repeated sinus infections. When you should seek a doctor's advice, again, usually if cold symptoms worsen after days 5 or 6 as opposed to start to get better, or if symptoms persist beyond 10 days, that's a good time to go see your doctor, because then I think he or she would be more comfortable probably writing you an antibiotic, make an empiric choice on an antibiotic for sinus infection. But as an ears, nose, throat doctor, if we're seeing patients who've had multiple sinus infections over the past year, we want to look for what are the risk factors. Why is this particular patient more at risk for developing sinus infections than the next person? Everybody gets colds, and anybody that gets a cold can develop a sinus infection. Doesn't necessarily mean you need sinus surgery or a major sinus intervention. But if there's a persistent pattern, repeat sinus infections, it may be because you have undiagnosed or undertreated nasal allergies, or it may be because there's some anatomic concern that makes your sinus drainage pathways less efficient than the next person's. And that's our job as ears, nose, throat doctors, to sort of figure out why a particular person develops more actual sinus infections than the next person, and then either address that concern and to prevent sinus infection, or if it's an anatomic concern, then intervene surgically to improve that anatomic problem.
So how do we evaluate this? I mean, you mentioned the CAT scan. but we can't give a CAT scan to everybody. So, how do we evaluate what's going on up there?
Yeah, exactly. So the first thing is obviously a good history and physical. You're right. We don't obtain CAT scans on everybody. If somebody were to come and see me and say I had a sinus infection, and my doctor or the stat care gave me an antibiotic, if it's not the best choice for an antibiotic, or if there are other medical therapies that can help in conjunction with antibiotics, then I would prescribe that and see the patient back. I'm okay treating one or maybe even two sinus infections in an individual a year if we can, if given the right antibiotics, we can get them through it. But if somebody comes to me and says, well, I've been on antibiotics multiple times every 6 weeks, it seems like I feel okay for 3 weeks and then I'm right back where I was, those are indications to start looking at perhaps getting a CAT scan, which is the image of choice really, and to try to evaluate the anatomy of the sinus cavities and the outflow tracts of the sinus cavities.
Can we see all the sinuses in a CAT scan, like the ones behind the eyes and all that
Yeah,
stuff?
that's right. And we can do that in our practice at Ohio Head and Neck Surgeons. We can do that right here in the office. But yes, there is a very specific CAT scan for the sinuses to image the sinuses.
Amazing. Go ahead, Brad.
All right, so I'm guessing surgery isn't always necessary, but
Right.
if it is, how do you do it? And what do you do?
Right. So sinus surgery, whether it's sort of minimally invasive sinus surgery like the sinus balloon that people may have heard about, or more formal sinus surgery that occurs in the operating room, the goal of any sinus surgery is to identify the natural outflow tracts of the sinuses and improve them or expand those outflow tracts, and irrigate the sinuses, evacuate secretions or polyps or cysts, anything that is impairing the outflow of the sinuses, and give the patient a clean slate moving forward, hopefully with better outflow tracts and better sinus anatomy that puts them at less risk for developing sinus infection. So in short, the goal of a sinus intervention or surgery is to improve the natural outflow tracts of the sinuses through whatever methods that are appropriate.
Okay, Doctor, it's the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com.
Okay, that's interesting. So I've heard of sinus balloons. Is that
Right.
an alternative to surgery, or can it be? And can it be done in the office setting?
Yeah. So if you have to, of course, have the right candidate, and you have to have the right amount of sinus disease. But yeah, given those conditions, we can offer balloon sinus surgery in the office just with numbing medicines in the nose. And so I've done a few dozen so far in our practice. The patients have done very well. There's not a lot of pain, and they just come into the office and go home. Takes about half an hour, 45 minutes. And patients obviously like it. It's less expensive. It's less invasive. You don't have to go downtown and park and all of those things.
So is this a permanent fix or this ballooning technique?
Well, it can be. I mean, if you make the right, if you're choosing the right patients and the right sinus disease, then yeah, there's no reason why you can't, fix the problem just with the sinus balloon.
How big is the balloon?
Now, the balloon is, it's not big. It's about 16 millimeters long. So,
Wow.
just a couple inches, about 1.5 inches, by only about a centimeter to centimeter and a half wide. So it's very small, and it goes in with a very thin applicator and then gets into the sinus cavity and then expands it. So, it's pretty interesting technology.
When would we use this? I mean, what?
Well, you would use it if you don't have to do. So sometimes when you're intervening or you're doing a sinus surgery, it's because there's polyps, there's fungus, there are things that have to be physically removed from the sinus cavity. That's typically going to happen in the operating room with a more formal sinus surgery.
Sure.
But if it's just trapped secretions, and especially if it's in a limited number of sinuses, and you have the right patient, they have to be able to sort of tolerate having things placed in the nose while they're awake and all those things. That's the kind of patient that's a good candidate for an in-office balloon. If we just need to get in, open the outflow tract, irrigate the sinus, and evacuate the secretions that we think are trapped in there, then that's perfect for an office-based procedure.
Well, this may be down the road on the questions here, but what about the polyps? Okay, you wouldn't use a balloon with polyps, right?
No, right. If you need to go in there and if a patient has polyps, which are just inflammatory masses that some people are more apt to develop than others, then those are typically going to need to be physically removed in the operating room. They tend to bleed when you manipulate them or remove them. It doesn't really lend itself to having somebody awake in the office. So those patients are typically going to go to the operating room.
So the instrument we use would be sort of like a colonoscopy, a little loop, and you cut the difference.
Yeah. Well, I guess the difference is, in a colonoscopy, polyps are on the surface.
Okay.
You don't have to get into a narrow recess or get into a small bony space in order to get the polyp out. So that's, the difference there.
Okay.
All right, so let's talk COVID-19 and sinus and allergies. Some have some similar or common symptoms, including a decrease of smell. So how are you helping patients evaluate the difference?
Well, fortunately, I haven't had too many COVID patients come in with the complaint. I've had maybe 3, but you're exactly right. The loss of smell associated with COVID or any virus, even the common cold, unfortunately, is typically a nerve problem. The smell centers, the primary smell centers in the nasal cavity are high up here in what we call the nasal vault. And so in order to smell, you have to be able to get air high up into the nasal vault. So things like polyps, inflammation, either from a cold or allergy, anything that obstructs airflow to the higher levels in the nasal cavities can give you a trouble with a loss of smell. And so one of the first things we need to evaluate if somebody's coming in for that is there a physical obstruction to the airflow in the nose? That's very easily evaluated with placing a small fiber optic camera in the nose in the office here just to look for physical obstruction. And that sort of thing is going to give you what's called a conductive smell loss. Nerve smell loss, unfortunately, is, again, the most common reason or the most common cause of something like that would be a virus. And it's not typically fixable. Sometimes it comes back and sometimes it doesn't. But there won't be anything to see on physical exam. There won't be anything to see on CAT scan. It's mostly about the patient's history, and the lack of physical obstruction in the nasal cavity is going to have you settle on a diagnosis of a nerve smell loss. It probably has to do with nerve inflammation, though we can't prove that. We may place the patient on steroids therapy, again, because they're the most powerful anti-inflammatory medicines that we have. But we can't tell you, it's hard for us to predict how much, if any, smell is going to come back and when it's going to come back. It could be a few weeks, it could be a few months, it could be never. So any viral illness can come in, the flu, a cold, and COVID-19, obviously, and cause a nerve smell loss, which is very unpredictable in its prognosis, unfortunately.
Okay, final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy on News Talk 1480 WHBC.
I guess we're welcome back to the Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. And we are talking with Dr. Aaron Brescia today from Ohio Head and Neck. I have to give a shout out today to our very special sponsor, Studio Arts and Glass, and Wendy Joliet. She is going to be on New Day Fox 8 Cleveland program from 9 to 10 a.m. next Thursday, talking about Studio Arts and Glass. And if you've never been to her shop, it's a trip. You need to go there. So, Doctor, we are on back. We kind of didn't finish this nasal polyps thing, did we? Or did we? I guess we did, huh?
I don't know.
Okay. How do we treat them? Do they come back?
Yeah, so nasal polyps are a pesky problem. They're typically associated with chronic inflammation. There are some patient factors that put some people at risk for developing them, whereas other people with all the exact same exposures don't develop them. That has to do with some of the genetics of the immune system for certain individuals. Anything that causes chronic inflammation can put you at risk for nasal polyps. Again, things like woodworking, being around solvents, but otherwise people just develop them even without those risk factors. They are a problem because they are just physical obstructions to nasal breathing. They can be physical obstructions to the outflow of the sinus cavities, again, leading to trapped secretions and putting people at risk for sinus infection. How we treat them sort of depends on how extensive they are and how miserable the patient is. If we see nasal polyps in somebody, we'll probably obtain a CAT scan of the sinuses to see if there is also then sinus blockage and trapped secretions in a sinus cavity. Doesn't necessarily have to be that way. People can just have nasal polyps in their nasal cavities, but oftentimes they're associated with sinus blockage. So there's probably going to be a CAT scan. Systemic or oral steroids like a Medrol dose pack or a prednisone taper can shrink polyps. If the patient is symptomatically doing okay with their level of polyps, you don't necessarily have to intervene surgically. Though we can't keep people on oral steroids long term, they can be used in the short term to help. And then administration of nasal steroid sprays like fluticasone, or the brand name is Flonase, that a lot of people have heard about. Things like Nasonex, Nasacort, Rhinocort. These are nasal steroid sprays. They can be used as a more on a daily baseline basis to help keep polyps controllable. But if polyps are too extensive or the patient is uncomfortable, can't breathe, can't smell, getting sinus infections, then those polyps have to be physically removed, typically with a sinus surgery in the operating room. And then post-operatively, the onus on ears, nose, throat doctors is to try to develop a strategy to keep the polyps that we know are going to come back at some point, unfortunately, try to keep that return to a minimum, keep it to some kind of manageable level so the patient isn't very symptomatic from them. So
I think it's interesting on the package, the nasal steroid package, that it says, looking at it a couple nights ago, one puff or one spray daily, as opposed to multiple. Apparently the so-called power of the product, it is extremely effective, and you don't have to use it 2 or 3 times a day.
what I will usually tell a patient is, patients can use nasal steroid sprays either 2 sprays each side once a day or 1 spray each side twice a day. And some patients like having they feel like for the first 3 or 4 hours after they take their spray, they really feel good and open. Then that might be somebody who wants to do it twice a day. So either one is indicated. 2 sprays each side once a day or 1 spray each side twice a day. But the key to any nasal steroid regimen is nasal steroids are designed to be used every day. They're not the kind of medicine that you can use because you're having a bad day, the pollen count is up, and so you're going to use your nasal steroid, but you might not use it for another 3 or 4 days. If you have a bad season for allergy, let's say you have a tree allergy and the spring is tough for you, you need to start probably 2 or 3 weeks before your allergy season and use it every day through that allergy season to really get the best benefit from your nasal steroid therapy. Nasal steroid patients typically won't see a good effect of the nasal steroid sprays for at least 2 or 3 weeks. So I always try to counsel patients, don't give up. If you're going to start a nasal steroid spray, stick with it. And I usually won't see patients back for at least 4 to 6 weeks for a return visit, so that then we can determine how effective or not it has been for the patient. A lot of people will try them for a week and then they go, well, it didn't really work for me, and then they give up on them. But that's not really giving them a good chance.
I think they're amazing. I mean, I use one of their, I think they're all the same pretty much. And I use one that started some time ago, and I think they're amazing. They really do a number.
Yeah. And you're right, the molecules themselves, the medicines themselves are all pretty similar. What's being developed now is more efficient ways to deliver the nasal steroid spray in a little bit more specific areas inside the nasal cavity where the sinuses open up and where polyps tend to form. So that's kind of the newest thing in the world of nasal steroids. Nasal steroids, of course, have been around for a long, long time, but we're trying to look at more efficient ways of delivering them exactly where we want them to get an even better benefit from them.
Well, so many people will not use a nasal spray. It's very interesting that, I can't do that. I couldn't put it in my nose. It's
right.
Convincing them to use one of these products. Oh, then they come back in and do it. Hey, this worked great, man. Thanks a lot. So,
yeah.
Anyway.
Well, especially something like your generic Flonase.
Yeah.
There's a little bit of alcohol in that carrier solution. Some people are averse to it. And so there are other medicines on the market that carry the same steroid medicine, but maybe in a more gentler solution.
I don't know where we're at on time. We got time to discuss allergy shots?
Well, I want to make sure we get Dr. Brescia's contact info and things of that nature. Let's do that. And then can you also add, do patients need a referral to come see you, or can they call your office directly? So if you could cover those things.
Yeah, sure. So we're Ohio head and neck surgeons. We're an ears, nose, throat practice. We've been in Canton for 50 years. There are 4 of us working here now. Myself, I'm Dr. Brescia, Dr. Charles Bogdan, Dr. Daryl Smith, and Dr. Kent Ramsey. And we're all local guys. We all grew up around here. Whether or not you need a referral to come see us mostly depends on your insurance provider. A lot of people are free to call and make their own appointments, but some people's insurance wants them to go through their primary care doctor to obtain a referral. So I don't have a blanket answer on that. But yeah, so we have a website, ohioheadandneck.com. And of course our phone number, 330-492-2844. And we're all actively taking new patients. We can typically, one of us can accommodate a new patient usually within 2 or 3 weeks. So it shouldn't be too difficult to get an appointment with us. And typically at least one of us is here every day of the week. So if there's a particular day of the week where a patient might have more of a chance to do things, get to doctor's offices and things like that, there should be a doctor here on that day for them.
Okay, doctor, thanks for coming on the show today.
Well, thank you for having me. I've enjoyed it.
We always learn something, particularly about our nose,
Yeah.
which is a real pain in the neck sometimes, So again, thanks, Dr. Aaron Brescia, board certified head and neck surgeon from Ohio Head and Neck. I'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis, who is gone today. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here Friday on News Talk 1480 WHBC.
You guys are clear. Thanks, guys.